Did you know that 90% of Americans are malnourished? If you're experiencing allergies, constipation, muscle aches, headaches, strong body odors, it could be what you're eating. Hi, my name is Dr. Sharon Pickford, and I'm a chiropractor and a clinical nutritionist. I help coach my patients on the importance of quality foods to help nourish their bodies. Did you know that every organ in your body requires whole foods to function properly? When you ingest over-the-counter synthetic vitamins, processed foods, sugary drinks, foods that contains pesticides, additives, and other chemicals, your body simply cannot process this as food, and over time, the body becomes severely depleted of nutrients. If you want more energy, decreased joint pain, better digestion, and improved sleep, let me help you start your nutritional lifestyle journey, and together we can begin healing you from the inside out. Call us for a free consultation at 323-238-2260.
All right. Okay, so good evening, everyone. Thank you so much for giving us your time. We highly appreciate it. Let me introduce to you all Dr. Pickford. Is a native of Los Angeles, California. She has 25 years of combined experience as a licensed occupational therapist and chiropractor. She earned her BS in occupational therapy at Loma Linda University and her doctorate in chiropractic from Cleveland Chiropractic College of Los Angeles. She also acquired her certification in applied clinical nutrition from Southern California University of Health Science. Again, everyone, let's all welcome Dr. Pickford.
Well, thank you guys for joining me. This is one of my one topic that I find to be the most interesting and the most important because, as some of you know, I deal with a lot of functional nutrition because I deal with a lot of functional health. And one of the things that I have been really focused on is making sure that my clients have the proper digestion, starting from the mouth all the way from the end. So we call it from the north to the south, okay? And leaky gut and talking about the gut and the microbiome is extremely important, and it's really wreaking a lot of havoc on our bodies. So let's talk about the gut, or the GI, which is truly a gateway for overall health. And there's a lot of information here, so I don't want to try to bore you, but I want to just do the best I can to keep it interesting. The gut microbiome refers to all the organisms that live in or on your body. That includes bacteria, yeast, fungus, viruses, and protozoa. Far beyond just digestive health, the following organ systems are also closely related to gut health, which is the immune system is related to gut health. The nervous system, the integumentary, I don't know why I messed that up, but that means the skin system. The endocrine system, which is your thyroid, your ovaries, your circulatory system, your respiratory system, and your reproductive system. There are 10 times the amount of bacteria in our body than our own cells, and the majority of them are found within our digestive system. There is 1 billion bacteria in just one drop of fluid in your colon alone. By the age of 3, our microbiome is almost fully formed and is very similar to the adult. That is why it is extremely important to breastfeed, because there are certain bacteria in the breast that helps build the baby's microbiome. Breastfed babies has a 20% higher survival rate than formula-fed babies. The GI system contains 90% of our body's happy hormones, like serotonin, but most importantly, approximately 70% of our immune system. Our immune system is housed in the gut. They didn't talk about this when I was in school 30 years ago. The health of our gut affects nearly every system in our body. And if they did talk about it, they didn't place any emphasis on it. They're still learning about it. What is leaky gut? Leaky gut refers to intestinal hyperpermeability and has become a common health problem today. And how? Intestinal hyperpermeability is exactly what it sounds like. The digestive tract is no longer able to ensure the good stays in and the bad stay out. So I want everybody to do me a favor. We're going to put 5 fingers up and keep them close together. All right? All your fingers are close together, right? And then I want you to slowly begin to separate your fingers, okay? Because your fingers are representing what we call the little villi in your colon, which is like little hair follicles. And they come far apart. Let me see. Yeah. And as you open those fingers up, you're allowing particles, undigested food, to fall into the palm of your hand, which represents your bloodstream. The bloodstream is not designed to digest no food, okay? So instead of the tight junctions or the proteins holding the intestinal walls together, they are loosened. This leaves sizable gaps, which is the widening of your fingers, sizable gaps of undigested food particles, digestive fluids, and toxins to enter the bloodstream. And what I mean by toxins, not just what you drink, but what you put on your body. The body reacts to these foreign particles in the blood by producing immune antibodies or pro-inflammatory cells to fight them off. This breeds chronic inflammation, food allergies, and various other health complications. Of course, there are no signs of improvement until the gut's permeability is addressed. Fortunately, we now have a better understanding of the causes, obstacles, and treatment methods for leaky gut. So there is a stop to this crazy cycle. So where do you find this bacteria? It's in your nose, your skin, your mouth, your stomach, your small intestines, your colon, your urinary tract, the vagina, okay? And so what's the function of the gut bacteria? A whole lot of stuff. It's not just passing bile through. It has an array of things. So it converts sugar to short-chain fatty acids for energy. It crowds out pathogens. It digests food. It helps the body absorb nutrients such as calcium and iron. And that's interesting because you find a lot of people low in calcium or low in iron. You got to think about what's going on in your gut. Some people say, oh, I'm anemic. Really? What's going on in your gut? It keeps a nice pH balance in the colon. Well, the colon keeps a nice pH balance in that environment. It metabolizes or it breaks down drugs. It modulates your genes. It produces digestive enzymes you need to break down your food. It helps synthesize or bring together and help put together your B complex vitamins. It helps synthesize your hormones. It helps synthesize your fat-soluble vitamins, which is A, D, E, and K, okay? It's used to train the immune system to distinguish from friend from foe, okay? And I read a book on the microbiome solution by Robin Chutkan, and this is what she had in her book. What we are finding is that the environment living inside of us, which is our microbiome, has one of the biggest impacts on our genes, turning them on and off, and determine which ones are ultimately expressed as a disease. Now, when my niece died at the age of 16 in her sleep, the pathologist told me that there was a sudden change in her genes, just sudden. Which, studying the microbiome, I realize now it wasn't just sudden. It changed because of something that was going on in her colon. Okay? How the leaky gut gets leaky. Several factors have been proven to negatively affect the gut's integrity. The most prominent includes the American Standard Diet. Exposure to chemicals. You know how you drive around in Torrance, or you guys, and you see all that smoke coming from at the top, that oil factory. Chronic infections, gluten and other grains, food allergies, excessive medication, huge. Poorly managed stress. Instead of going to exercise, we turn up a bottle of vodka. The standard American diet, rightfully known as the SAD diet, is one of the leading causes of chronic health issues we see today. According to a 2022 study conducted by the USDA, 63% of the calories Americans are consuming come from ultra-processed foods containing preservatives, refined grains, added sugars and oils, sodas and snack bars and yogurts and breakfast cereals and muffins. It's almost as though the general public took it upon themselves to refigure the food pyramid to consist of grains at the top, dairy in the middle, and sugar. No, I'm sorry, grains as the base, dairy in the middle, and sugar at the top. It was never to look like that. Okay? When all in honesty, none of these foods have any business being a part of our diets. So, fraud. You can call it what you want, but fraud, breaking foods, food-like substances, fake food. Okay, you can call it all of that, but you most definitely can't call most of our food supply real food. It is not real. Even some of that vegetarian stuff they got out there, that is not real. You're better off eating a steak. When the majority of our diets are packaged meals with paragraph-long ingredient lists and labels we can't understand, we're not eating real food, people. Okay, you've got to read your ingredients. It's extremely important. Alarming facts. The FDA has approved approximately 3,000 different food additives, preservatives, and coloring without adequate research on safety. The average person ingests over 150 pounds of additives each year. This is only one factor in the leaky gut epidemic. This is just one, okay? But definitely a big one. Up next, we will be discussing the factors responsible for the onset of progression of leaky gut. So, sick and inflamed. Let's talk about inflammation for a minute. So normally with inflammation, it's a vital immune response. It's normal. It's what we're supposed to have. And it's the body's attempt to defend itself against pathogens, heal from injury, and repair damaged tissue. Now, say for instance, you get a sting and a bite from a mosquito or whatever, right? And you start scratching and it starts turning red and then it starts swelling up. And then you can see your pores opening up. It starts to look leaky then, right? Because the pores are all wide, right? Imagine if that never went away. Just imagine. Now we're dealing with chronic inflammation. However, it's not beneficial to our bodies in any way. In fact, it can worsen the body's ability to recognize foreign invaders and puts the body in a state of stress for extended periods of time. This can cause lasting damage, increased food allergies, and eventually autoimmune disorders. This type of inflammation can be caused by a number of things, but largely seen as a result of leaky gut syndrome and poor dietary habits. How often are we eating out? Okay. If chronic inflammation goes untreated, leaky gut just gets worse and the body ultimately loses its ability to repair from the damage. So let's just talk about gluten. This is just one. This is a major one. Gluten, a mix of proteins in grains such as wheat, barley, and rye. You see all that pasta up there. Seen in packaged foods and pre-prepared dishes. It is no surprise that our consumption of gluten has increased immensely and our health is suffering from it. So gluten allergies, sensitivities, and tolerances are becoming increasingly more common. Gluten-free has become a buzzword within the health community, and people are finally beginning to explore how dangerous gluten can be for the health. So how dangerous is it, you ask? Well, gluten makes your gut leaky. Simple as that. Zonulin, a protein found in gluten, increases the permeability of the gut by further opening this space, and that's already open. So we open it even more, okay? Between those cells, the antibodies, and then there's antibodies, right? The antibodies normally released as a result of leaky gut are accompanied by more antibodies created to attack one of the gluten's more prominent building blocks, which is called gliadin. This leads to more inflammation, more body confusion, more health complications. So in other words, your body reacts to the consumption of gluten by creating a mechanism to fight it. Once this damage has occurred within the digestive tract, it is then distributed throughout the entire body. How do harm? Aside from the contributing, if not entirely causing it, leaky gut, gluten increases inflammation, overall digestive distress, and alters the body's microbiome. So our microbiome, which I think of the microbiome as a huge acres and acres of farmland with all these different vegetables, right? And we're hoping that all these vegetables are good for us. That's when I think of a microbiome, but it's in our gut instead. So our microbiome must be equipped with efficient, healthy bacteria in order to be successful in carrying out a necessary function. Without the proper balance of bacteria, the following functions are disrupted: digestion, immune, nutrition absorption, hormone regulations, vitamin production, detoxification, what takes place in the liver. And your mood begins to change. There's a whole lot of other things that goes on after that too. Okay, so you got primary effects of gluten, you got secondary effects. We've been mostly talking about the primary effects, right? And here's a few more. Intestinal hypermobility, again, we just talked about leaky gut. Permeability of the blood-brain barrier. So it makes the blood-brain barrier, allows things to go even in the blood-brain barrier, right? Even more so. That opens it up. We don't want it's bad enough the gut lining is going to be opened up. We don't need the blood-brain barrier to be opened up. The onset of autoimmune disorders such as celiac, Crohn's, ulcerative colitis. That's a humongous list in itself right there. The development of psychological disorders. They're just starting to now really see that people that's having psych disorders, now they're looking at the gut. Dysbiosis, that's a whole nother topic. And abnormal bacteria go back and wreak havoc like inside out. Acute allergies and delayed antibody responses. While all of these issues are very serious within themselves, they too cause other further complications, which I just mentioned. Next comes the secondary effects of gluten. So now we got severe nutrient deficiencies such as iron and vitamin B. And I like to point that out to a lot of my vegans and vegetarians. Be very careful. Those are two of one of the main things that you usually are depleted in. Iron and B12. Why? Because they're not eating meat. And a lot of vegans and vegetarians become carboholics, white products. So you got to be careful. Then there's systemic inflammation leading to organ and tissue breakdown. Kidneys are starting to break down. Liver is starting to break down, okay? It may seem a bit redundant that we keep going back to how a body acts on gluten, but it's one of the most important pieces of information you can take from this class. Gluten is a major component of leaky gut cycle. It is present in the onset, the maintenance, and the progression of this damaging condition, and it should not be taken lightly. Okay? Gluten's path to disease. I'm going to try and make this one quick. But first step is when gluten contribution goes unnoticed. A lot of people, they don't even notice it. It's like, they don't have any symptoms, blah, 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 blah. And then when you talk to them, I was like, well, gluten doesn't hurt me. Therefore, I can eat it with no problem. Well, the lack of apparent symptom does not mean that gluten doesn't hurt you good. Exposure over time and the accumulation of damage is where you start having the problems. Sorry, that's my little dog. So let's talk about hypertension. I'm just going off the grill. It's a silent killer, right? But it can still cause some problems, okay? So just because, again, you don't have these apparent symptoms and it's silent doesn't mean stuff ain't going on in your body. The next step is the progression of subclinical problems. And excuse the dog, I'm at home, this is real life. This is where leaky gut truly begins to develop. Often the first thing that will be noticed is increased food and environmental allergies. And I have a lot of people who've had environmental allergies for a very long time. And they all just say, oh, it's pollen, it's this, it's that. And I'm like, have you really taken a look at what you may be eating? Digestive stress may begin to become more frequent. Unfortunately, it is common for people to still avoid blaming gluten for their discomfort, because everybody want to eat their little sandwiches and their little bagels and stuff. I get it, you know? The last step is recognizing the problem. Okay. However, it is not usually recognizing gluten as the problem, but the acknowledgement of the problem that gluten has caused. For example, if someone is diagnosed with a chronic disease or develops an inflammatory changes, most medical doctors will begin treating these conditions rather than examining the origin. You know what the origin might be, right? It's a shame that this happens so often, as if gluten was recognized as the main problem during the early stages. Then a lot of these health issues could be avoided entirely. Gluten, however, is not the only concern when it comes to solving leaky gut. We will be going over other issues that contribute to this dangerous syndrome in a moment. Now, I'm sure everybody know what a measuring cup looks like. It's got the little measuring lines, and it's got a quarter and 1/3, and it's got the cup, and it goes into two, whatever, right? So some people, say, for instance, you got water, right, and you stop right at maybe a quarter of water, and imagine that being the gluten. You don't have any discomfort. You don't have any problems, no problem. Then you add it and you take it a little higher. Now you add a half a cup or 3/4 of a cup. Now you start feeling some symptoms, okay? So sometimes it depends on how minute the wheat is. You may not have any symptoms at all, but it's got to be on a very, very, very low microscopic level, okay? Say no to pesticides. Huge. I think about this poor guy in this picture that's spraying these pesticides, and I would love to see his lab work in the next 5 to 10 years, because I'm sure he's going to pay for it. Much like additives and preservatives flooding our food supply, pesticides are also a big part of what's on our plate. There are 3 million tons of pesticides here. 3 million tons. Let me repeat that. 3 million. I'm repeating 3 times. It says 3. 3 million tons of pesticides used worldwide each year, and more than 16,000 chemicals involved in the production of these pesticides. Studies to ensure safety on humans have been very, very limited. However, some have no documented research at all. Let me repeat that. Whereas some have no documented research at all. While we are not entirely sure of their safety on human health, we do recognize strong links between pesticide exposure and the nervous system, the reproductive system, the thyroid, obesity, migraine, your immune system, hormonal imbalances, type 2 diabetes, asthma, attention problems in our children. The magnitude of that pesticide, along with steroids and hormones and antibiotics and exotoxins, show up in our food supply is truly frightening. And to think it isn't a main component of our leaky gut is simply impossible. No more drugs. See all those antibiotics? I'm an occupational therapist. I go to people's home and I do home health, and I have clients that are on so many drugs, and I'll say, what is this for? And they'll say, baby, I don't know. I don't even know why I'm taking this. So much medication that our people are taking, or the public is taking. Medication is severely overprescribed in the current medical model used today. But what isn't taken into account is how these excessive prescriptions have affected our bodies. And I'm talking over the counter, which is the stuff you get at CVS as well. So let's talk about a statin. Statin is a drug that's used to lower cholesterol. There's a lot of you that are on it, and it has been shown to actually lower your vitamin D and your coenzyme 10 levels. Coenzyme 10, that helps with the cells to make energy. Now, we know during COVID, there was an issue with vitamin D, right? Okay. And vitamin D is a fat-soluble vitamin. So even if you're not on a statin, is your colon able to help synthesize the vitamin D? While it may be lowering your cholesterol, it is simultaneously causing nutrient deficiencies, muscle fatigue, increased blood pressure, and weakened immunity. Painkillers. We all are familiar with ibuprofen, naproxen, and aspirin. That's the first thing they give it is naproxen. That contributes to vitamin C and iron deficiencies, leaving one vulnerable to disease and eroding the micro lining of the stomach. Can you imagine a lawnmower in your stomach? Somebody just walking back and forth, tearing up the lining. Painkillers. Acid reduction medications hinders the digestion of protein, calcium, and B12. There you go again, B12. That can cause a lot of problems. I've had patients on B12 issues, with B12 issues, often causing chronic pain problems. Long-term use of antidepressants too significantly impact the gut's motility and causes digestive issues. Motility. Now your bowels aren't moving. Okay. Lastly, it's important to know that almost all medications are unable to differentiate between the good bacteria in our gut and the illness it's trying to attack. That results in an altered microbiome and a much greater risk of infection. Now, as you can tell, drugs offer a lot of unintended consequences that can affect our health very badly. There are very few situations where drugs should be your solution, such as life-threatening, of course, infections or surgical situations, definitely. Without the immediate emergency needs of medication, it is best to treat the issue than it is to temporarily patch it up with a problem. The beginning of functional treatment. So everybody knows what I do with a lot of functional treatments. So the first step of healing is ruling out the fundamental cause of leaky gut. What's causing it? Do you have dysbiosis? Do you have, are you eating too much gluten? Blah, 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 blah. It's important to recognize that it is very rarely only one cause. It could be a combination. You must first rule out or begin to recognize the following: vitamin deficiencies, test for that. Functional nutrition testing, I actually do that. Infectious pathogens by blood and GI, which is the gut tract test. Heavy metal toxicity by urine and hair testing. We do a lot of hair testing as well. Gluten sensitivity through the HLA-DQ genetic testing. Environmental allergies via skin and blood tests. If any of these come back positive, you have your first step of instructions. Address the deficiencies, implement dietary changes ASAP, limit exposure to allergens as much as you can, and consider detoxification methods. I have a detoxification method not a method, but a detoxification program that I put a lot of my clients on. You've got to do at least a detoxification cleanse at least once a year. Twice would even be better, but if you can do once, hey, that's something. Once you have a better understanding of your body's unique needs, you can begin the formal functional medicine protocol, which is the 4 R's. Let's talk about that. Functional 4. The 4R programs is administered to help you heal from digestive stress, reverse gut complications, and rebalance your gastrointestinal microbiome. It is an incredible tool to acknowledge and treat health issues, dysfunctions, imbalances, and personal health needs. And it's done in the following order. You want to remove, you want to repair, restore, and then replace. So remove. Let's eliminate problem foods, eating out, fast foods, foods that's got the long ingredients, foods that you can't recognize and you don't even know what the chemical is. So eliminate food problems, the toxins, low-grade infections, and oxidative stress. Repair. Begin reintroducing a clean diet with essential nutrients in your body. What do we mean by clean? Just try and get fruits and vegetables that don't have that pretty wax on them, okay? Go to the farmer's market. If you got a garden, if you have some grass, grow you some vegetables again. Put them in a pot. I don't grow vegetables, but I subscribe to a company that has a garden in the area, and every Sunday they drop off a nice little bag of fresh vegetables right in their garden. So there's no really excuse. Browse even got some organic vegetables, okay? Restore, repopulate your gut with healthy bacteria to restore the proper balance of your gut. Replace digestive enzymes, antioxidants, and immune-boosting vitamins to promote sustainable and healthy digestion. We, as functional medicine practitioners, are trained in this protocol and enthusiastic about making sure your Individualized needs are addressed during the process. Remove the bad. At this point, you may have already removed things you already knew were to be detrimental to your health. At least if you haven't done it yet, you might do it later, such as gluten and non-allergies. But you'll also want to remove much of the chemicals burden in your daily life. And I talk about this in my detox programs. Pesticides on your food, genetically modified organisms, unnecessary medications, unnatural household cleaners. Oh my God. I go to people's houses and I see all kind of chemicals, bleach, pine salt. We've been using that stuff for 100 years, but guess what? That stuff is not good for you. Because guess what? You're breathing it in. If you don't use gloves, it's still getting into your pores. Okay? Bleach, for me, gives me an immediate headache. Repair, restore, replace. Once you have an understanding of what should be removed from your daily life and you have begun to implement those changes, it is time to begin repairing the damage that had previously been done. This is done by calming chronic inflammation and calm it down and reintroducing nutrient foods. Digestive enzymes. I'm huge on giving patients digestive enzymes, probiotics, essential fibers, vitamins, minerals, and you need minerals. A lot of people just get vitamins and they don't realize you need minerals. Okay, you need minerals almost before you need your body can function on minerals, but if you got vitamins and you don't have minerals, your vitamins are not as effective. Okay, for some people, these steps may mean implementing intermittent fasting, supplementations, or personalized diet plans that cater to those specific health needs. Again, be sure to consult with your functional medicine practitioner to ensure you are beginning the most appropriate repair route for your needs. Supplementation spotlight, and we're almost finished. Nutrients must be replaced for effective healing. While everyone's needs are highly individualized, and I do system surveys on all my clients, and what system survey is basically subjective questions, and so you sort of say yes to this, or yes to that, and so it's individualized to that person's complaints. So while everyone's needs are highly individualized, here are some common supplements that have been proven to be helpful in the healing of the gut. You got the probiotics. They're basically live bacteria. They're the good bacteria. You got prebiotics. They're non-digestible foods that promote the growth of the good bacteria. You got digestive enzymes. You got fiber, collagen, turmeric, glutamine, which is an amino acid. You got quercetin. These are only suggestions. We are unable to prescribe these supplements to you without comprehensive testing, as everyone's nutritional needs vary. However, the main takeaway from this is that you should not rely solely on supplements. Mm-hmm. They can be used to help your healing process, but the goal is to be able to sustain wellness with whole foods and healthy lifestyle choices long term without the need of piles of pills. Okay. Now unfortunately, we live in a country where we're constantly bombarded with pollution and pesticides and billboards. Every time you drive down the street, they got a big old fat juicy hamburger. So it takes a lot of discipline. So for some, you may need to continue to take good whole food supplements, not synthetics, not stuff that's made out of a lab, not something that you would get from some of these common stores where it has mostly soy in there. You want to stay away from those synthetics, okay? Maintenance. The most difficult part of health is maintaining it. We just talked about that. Even if you build a strong foundation during the healing process, without the proper diet, lifestyle choices, and stress management long term, you can fall right back into the same gut-destroying pattern. So remember, health is a journey, not a destination. It's always a struggle. And I want to thank you for taking the time to experience this class. We love sharing this topic with people who are eager to transform their health. And this group was just fantastic. If you have any further questions, please post them below, and we will be more than happy to address your concerns. Please remember that we are always here to support you. And I took a little bit of my information from this book, Rachel is going to send the link, put the link in the chat box for you, along with a couple of other links. But I had the privilege of seeing this young lady, a medical doctor, Robin, speak in February in Vegas at a chiropractor's convention. And she had about 3 books, but that book was like my little Bible. It just went into so many amazing details. And so I'm finding myself moving more and more and more and more towards the microbiome, the gut, digestion, enzymes, because it's not what you eat, it's what you absorb. And if you can't absorb it and you don't have the right enzymes, it doesn't matter what kind of diet you have. Be it pescatarian, vegetarian, meatitarian, it doesn't matter. If you're not absorbing it, okay, that's when you're going to have all the problems. Happy healing from Dr. Pickford. Any questions?
Yeah, no, I have a question. So what specific products are you recommending for leaky gut?
Well, again, everybody's individual. So I would have you do a system survey first. And then based on the system survey, so the system survey is grouped into like different categories, and each category represents an organ. And so if you have, say, 10 checkoffs in one of the organs and only 2 or 3 in the other ones, the 10 checkoff tells me that's the organ it needs for us to address. Okay. And
Okay.
yeah, because we want to make sure, because you'll have leaky gut. Well, again, you want to know why you have leaky gut. Is it because I've had leaky gut and I still suffer from leaky gut? I've controlled it a lot, but one of my issues with leaky gut was I had dysbiosis, which is a different array of different yeast in the body. So I have my clients stick their tongue out. If you see a white film, then you definitely have some kind of candida or yeast in your body that you want to really address, because yeast can wreak havoc. They have a book out there called The Yeast Connection, and it talks about the dangers of having so much built up yeast in the body. So it's not something that you want to just say, oh, well, what do you have for this? Or what do you have for that? Your individual need may be different from somebody else's. Okay. We may need to, you may not even have leaky gut, but then you might. I'm not really sure. But most people do. A lot of people have it and they're not even aware of it. We are done. And thank you guys again.